Hi, everyone. Thank you so much for either being here today or for watching this recording. My name is Mariah Blevins. I am CFHI's program coordinator. I'm happy to be here today to share a little bit with you all about CFHI and who we are as an organization, and then to also talk about a few of the opportunities for global health experiences that we offer to you. So I'll just go ahead and get started with a brief overview of CFHI. So basically, what we are, we're a nonprofit organization, and what we offer are ethical, fair trade, and immersive global health education programs to students and academic institutions. What's really unique about our programs is that they're intentionally built off of the foundation of local leadership. And also, we really take ethical considerations and integrity into account. And we also really try to take an asset based engagement approach to our programs. In a nutshell, a program is really an opportunity to learn about the healthcare system in another country, learn about public health and how health is implemented in a new environment through different types of clinical rotations, public health activities, and just general health experiences. And you're really getting to do this alongside local healthcare professionals, all while, of course, immersing yourself in another culture. So CFHI has offered programs for 32 years now. We currently have programs in 10 different countries, and we have a few different options that are available to you, which I will share a little bit later. But over the last 32 years, we have sent over 16,000 students abroad to our programs. So we have a lot of experience in the building of our programs as well as sending students abroad. What sets CFHI apart from maybe other organizations you've heard of or experienced? First, we are in special consultative status with the United Nations, and this really recognizes that we bring to life the SDGs and other WHO initiatives into our programs. We're also a recognized nonprofit for our work in transparency, diversity, and inclusion, and also our leadership in experiential education. And of course, most importantly, which I've mentioned, but I'm going to keep mentioning this throughout the presentation, CFHI's framework is really unique in that we prioritize preserving the authenticity of the local community's expertise while nesting our programs in gold standard, ethical, and educational best practices. Unlike other approaches to global health, we're not, we don't do missionary work. We're not a global brigade. What we do is really challenge the traditional colonial mindset and approach to global health, and we strive for very thoughtful and reflective engagement in our programs. So all of our learners are really immersed in an existing healthcare system alongside our longstanding partnerships on the ground. And these partnerships have very deep shared value alignment and vision. If you're interested in reading about ethical engagement and global health, or if you just want to know a little bit more about why CFHI structures our programs in the way that we do, I always encourage you to take a look at our website and just read a little bit more about some of the thought leadership that we've been involved in or that we stand behind. So you can go to cfhi.org/publications. But just to kind of explain a little bit better why our programs are really built off the foundation of ethical engagement. This is because ethical considerations are just really fundamental in guiding our global health efforts, especially as we are continuously working towards just, respectful, and sustainable practices that really prioritize the well-being of global communities rather than cause harm. When ethics aren't properly considered in global engagement, this might look like outsiders unintentionally disrupting the local healthcare structure by, implementing programs that don't necessarily align with the existing systems or existing priorities of the community. This could also look like unintentionally reinforcing a savior narrative, which it's all too common, unfortunately, and has been in the past. And this can really lead to unrealistic expectations and dependency on external assistance. And lastly, this might look like students engaging in medical procedures or activities that are beyond their level of expertise or training, or might be in an environment that just lacks the necessary resources for adequate supervision. So this can not only jeopardize patient safety, but also put the visiting student in harm's way as well. So that's just why it's important to really consider, how we're approaching global engagement and how our approach is going to be ethical. um, CFHI's approach, though, there's a few different things that are happening to really align with this. First and foremost, I mentioned this earlier, but we emphasize the existing health systems and resources within the local community you're visiting. So instead of coming in with outside resources or maybe underlying assumptions of what we think the community needs, um, we really are showcasing the existing, health systems and resources that are in place within that local community. And we're also upholding local practitioners as the experts of their own environment. So you're joining a local team on the ground where you go, and they're really the ones who are responsible for the narrative of your program. They're arranging your clinical rotations and all of the activities that you do. We also encourage students not to take a deficit-oriented approach, and the program really intentionally tries to highlight the strengths that are present within the community you're visiting. And this approach really allows for a more authentic and balanced understanding that might contrast, what you see here in a U.S. experience versus those abroad. And we really try to avoid creating any sort of misleading or oversimplified narrative. Um, and of course, this is going to help us promote a more respectful and truthful engagement. And it really allows us to acknowledge like local capabilities and resourcefulness. We also practice fair trade learning and partnerships. So, as I mentioned before, we have longstanding relationships within each of the sites that we have programs, and you're really joining the local team members there who are from our global community. And then lastly, before you go, we're going to facilitate cross-cultural training and preparation for your international experience, just to make sure that you're really well prepared. And we also are going to encourage critical reflection before, during, and after your program to help you make the most and derive the most out of this experience. Okay. So it's important to know that during your clinical rotation, regardless of training, you're never going to be in a position where you're directly responsible for the care of a patient. So you'll never be handling sharp objects. You won't be diagnosing. You won't be treating. Your role in the program is really to learn, and you're going to be involved in engaged observation. So you're definitely not just standing in a corner and watching. What this means is that you're really getting to build a relationship with your different preceptors and the different types of health activities you're doing. And you're really strongly encouraged to, build dialogue, really reflect on the things that you see, keep a journal, and things like that. So it's just important to know you're never going to be, in a hands-on patient care position. So the experience in and of itself, first and foremost, you're really building competencies in global health, and this is going to be an invaluable opportunity for you to really apply your knowledge that you've learned so far or skills that you're building throughout your academic journey in a real world global health setting. And also, it's a great opportunity for you to explore potential career paths. Maybe you're considering going to nursing school or medical school or pursuing your Master of Public Health. You're really going to be exposed to, different areas of global health and public health, as well as, learn about things like different healthcare systems, social determinants of health, global burden of disease, and things like that. You're also really getting to immerse yourself in diverse healthcare environments. So many of our programs have different opportunities to be in a clinical setting versus more work with NGOs and CBOs. And then on top of that, of course, your tangible skills that you're really developing include, cross-cultural communication, adaptability, resiliency, thinking outside the box. So yeah, these experiences are really going to help you hone in on some of those skills as you're finishing up your academic journey or thinking about what your next steps are. You're also, getting to build your language skills. If you choose a program in Latin America, then you do have the opportunity to take Spanish classes, and you're really building your Spanish language skills. So there's so many beautiful things to get out of a global health experience. So now I'm just going to talk a little bit about some of the opportunities that CFHI offers to you. We do have program locations in 10 different countries. The ones I'm going to share today are the ones available to you. So we'll talk about a program in Bolivia, Uganda, and India. So just to give you like a little bit of a background, I mentioned earlier that we do have a local team on the ground who's facilitating your program at all of our sites. So the local team consists of a local medical director. This person is the one who is responsible for overseeing all of your clinical rotations and your health activities. And then we do have one or more local coordinators at each site, and they are the people responsible for overseeing your lodging and transportation, your cultural activities, and anything like that. And then lastly, the preceptors are going to be the individuals who you're getting to shadow in your clinical and public health experiences. And I always just like to give a little shout out to our amazing global team members because this work would not be possible without them. Even though I'm the one here today, I'm representing a lot of other people who make the programs possible. All right, so the first program I'll talk about is our program in Tarija, Bolivia. So this right off the bat is going to be a good program for you if you are interested in improving your Spanish skills. It is recommended to have an intermediate level Spanish already or above. So what that would mean is that you are pretty comfortable in like a conversational setting, um, but it would be a little bit more challenging if you're a beginner level Spanish speaker to join the program. However, in this program, you do take Spanish classes and do cultural activities at a local language school. So you're really getting to improve your conversational Spanish. You're also getting to learn about medical terminology. And then you also stay with a homestay family, which of course is a very amazing experience to immerse yourself in the culture, get to practice your conversational Spanish as well. In terms of the types of rotations you might experience in this program, there's a few different themes that go along with this program. So you're going to get to learn about hospital medicine, primary care, community health. One of the emphasis of these programs is infectious disease and vector-borne diseases. So if you're very interested in learning about Chagas disease or malaria or other infectious diseases that are spread through mosquitoes and other vectors, then this is a great program for you. And also your rotations, you'll have exposure to a lot of different types of departments or specialties when you're in the hospital. So for example, you might get exposure to the pediatrics department or the maternal health department. And then your rotations will also take place in different primary care clinics in the city. So this is a really great program to receive a very thorough overview of the healthcare system and different levels of care in the country. Tarija, Bolivia itself is a pretty laid back environment. It's in a more rural setting, so you'll also be receiving like an urban rural comparison and getting to learn about rural health in the program. Secondly, we have a program in New Delhi, India. This program is a really great exposure to public health, burden of disease in India, and also an opportunity to learn about the innovative public health strategies that the country is doing to help combat some of their health challenges. New Delhi, India, of course, is the capital city of India, and it's one of the most populated cities in the world. So it's definitely a very urban setting. Your rotations here are going to take place with various different NGOs, CBOs, and public service agencies. Some examples of the types of NGOs you might get to work with include an environmental and social service NGO. There's also an LGBTQ community center and HIV counseling and treatment center. There's a juvenile rehabilitation center, and there's also a rural nonprofit hospital and a couple other hospitals as well that you might get to tour or rotate in. So this one is there's a lot of different opportunities. So if you're interested in more of the public health and NGO type work, this could be a good fit for you. And then the lodging in this program is going to be in a shared apartment. So you'll be staying in an apartment with other CFHI participants. And this is just really to talk about what to expect. So, of course, you have an application process with your university. So that's kind of your first step is to get accepted by your university. And then once you're squared away with them, CFHI is going to share with you separate enrollment instructions for our own website and application portal. Everything on this portal is really just designed for us to be able to help you have a positive experience. So once you receive those instructions, you'll apply on our website and you'll be given access to various forms to fill out. For example, there is going to be a form on placement preferences. So if there's anything, specific that you want to see in your rotations, or if there's, a specific NGO or CBO that you want to rotate with, you'll have the opportunity to share that with our team before you go. And, you'll be, your schedule will be placed accordingly and based on availability. There's also a lodging preferences form. So if you have any special requests for the homestay family or lodging, or if you have dietary restrictions or allergies or things like that, that's where you share that. And then very importantly, there is going to be a set of training modules that I mentioned. One of them is specific to the program site you're going to. So it's going to have a lot of important information about the program itself, logistics, health and safety, what to bring, things like that. And then you'll do the few other modules I mentioned, which center more around cultural training and global health ethics. In terms of the kind of what to expect as you're getting ready to travel, CFHI will have a mandatory pre-departure orientation for you before you go on Zoom. That will be a few weeks before you go, so it's a good opportunity just to make sure everything is in line and you're ready to go. Your local team will also schedule a call with you before you go so that you have a chance to meet them and ask any last minute questions you have before you travel. Once you're on the program site itself, you'll be picked up from the airport by our team, and you will also receive an on-site orientation the day after you arrive, just talking about things like safety, program logistics and schedule, cultural considerations, and things like that. Within the program itself, you can expect to be provided lodging, of course, 2 meals per day. The third meal per day is left for you to explore the local cuisine. In terms of a day in the life of a program, you can expect anywhere from 5 to 6 hours a day of your health focused activities and rotations. If you're going to the Teddy Hub Bolivia program, you'll have language classes in the afternoons on most of the days per week. And then you can also expect at least one weekly meeting with the local medical director, which usually serves as time to give a lecture on a different aspect of the healthcare system of the country, as well as provides a reflection and discussion session for you to ask any questions or seek any clarification on something you saw in your rotations and things like that. And then very lastly, of course, you are backed by not only your institution support, but all of CFHI's health and safety support as well during your time in the program. So there's just a lot that goes on in the background to make sure that you're having a very safe and positive experience. Okay, that is all I have. I always invite students to take a look at some of our social media. Definitely go to our website as well if you're interested in exploring a little bit more. But our social media post things all the time, like alumni testimonials and a day in the life of a CFHI program. So definitely check out our Instagram, and you can just see pictures and testimonials from alumni, so you can get a better understanding for the program.